Let me get started by introducing our next speaker. Kathleen Hoke is a law school professor and director of the Network for Public Health Law, the Eastern region, and also the director of the Center for Tobacco Regulation at the Maryland Carey School of Law. She teaches public health law and gets a lot of her students engaged in the work of the network and the center. Kathy is a wonderful colleague and friend, and we've been working together for a long time here. I think she's been at every one of the 16th 16 conferences and one form or another, and she provides a lot of technical legal assistance to Maryland state and local health officials, legislators, and organizations. So welcome, Kathy. Glad to have you here. Wish it were in person, and I'll turn it over to you.
Thank you, Carlo. And yes, I do believe I've been at all the best practices. I'm also a TCRC board member. And so I'm obviously completely supportive of all of the work that TCRC does. I too, I'm sorry that we can't be in person again this year. And our May conference for the Legal Resource Center will also be virtual. So one day we will owe all of you a really great lunch.
We'll be back together.
With spectacular desserts. So to get, I'm going to do a brief overview. I'm going to keep it brief. So if there's any questions, you can ask them at the end or in the chat or get in touch with us, but about the legislative session. So what happened in 2021 or what didn't happen in 2021 and what's going on in 2022. First, just a reminder to folks that the Legal Resource Center hosts a biweekly conference call where we review pending public health legislation, including tobacco legislation before the Maryland General Assembly. Folks can talk about bills that they might be working on and ask others for support or guidance. And so feel free to join the calls. You can send us an email if you're not already on the listserv. We also maintain a tracker where our students are tracking bills across a variety of different public health areas, again, including tobacco. That document is a Google document that's live all of the time. Our students are doing constant updates. And so even if you don't want to join the calls or can't, you can get access to the document. So just send us the email and we'll make sure that you get on our radar screen. So just from last year, I just want to point out one bill that we thought, had some good stuff in it, but needed some improvements that didn't pass. And this would have regulated ESCs or vape products. And I think that first prong is what's maybe most significant and what we're seeing kind of at least being discussed across the country. And that is only allowing the sale of vape products at vape shops. We all have them all over our communities, I know, but at least then we would eliminate the sale of Juul and the like at convenience stores and pharmacies and mom and pop shops and those sorts of locations. The more limited the number of outlets are, the more focused our enforcement can be, and actually the more likely we're to have compliance, particularly with youth access issues. There were other elements to the bill, including a flavor ban that made it, I think really tough to get passed. And so it was not successful last year. I don't think we're actually going to see the return of this in 2022. A lot more groundwork needs to be done and, kind of maybe less distraction from a pandemic to put the focus on this bill. But I just did want to note this one from last year. We also last year had a flavored tobacco ban bill. And it likewise had very good provisions in it, but some concerns that we had about some of the provisions being amended away. But this was a comprehensive bill that included menthol cigarettes. Many of you, if you've attended our conferences and are otherwise engaged, know that there are significant issues associated with, as our first speaker spoke to, the LGBTQ+ community, higher rates of smoking menthol, as well as the Black community and other communities of color. And so we're really interested in this as both an important tobacco control measure, but also a health equity measure. The bill did fail last year. Again, this bill is not coming, like the other, this bill is not coming back in 2022, to our knowledge, and hasn't been thus far. Again, I think there's a lot of groundwork that needs to be done on this in better times when we can have more access to the legislators to really explain the fundamental principles that undergird this legislation. Another bill that died last year, but this one I'm actually about to go testify on once we're done here. And so a little bit of discussion here for folks who don't know. In 2013, a Maryland Court of Appeals decision determined that local jurisdictions in Maryland, so our counties, lacked or were preempted from regulating the sale and distribution of tobacco products. It's a bad decision. I don't want to get into all of that, but the impact of it has been that local legislative bodies around the state have not been able to, for example, prior to the state passing T21, they couldn't pass a T21 bill. They couldn't pass a flavored ban at the local level, or some of the other provisions from that vape bill that I mentioned. They can't do that at the local level because of the interference of this Court of Appeals decision. So for several years, we've tried to get a reversal, essentially, of that decision through this positive legislation, restoring back to the local jurisdictions their local power. The bill's up again it failed last year, up again this year as Senate Bill 99, and then I think there might be a House bill now, and I'm sorry that it happened in the last 24 hours. And then there's a Baltimore City version that will restore this power specifically for Baltimore City, Senate Bill 249. Today is the hearing, as I said, on Senate Bill 99. As soon as I get done with you, I'll hop over to that. And then the Baltimore City bill will be heard in the Senate Finance Committee on February 3rd, and Brooke Torton of the Legal Resource Center will be handling that. This is incredibly important, just like we did with clean indoor air, where there was a momentum throughout our counties, and ultimately the state passed the statewide clean indoor air bill. We know that that would happen with other issues in tobacco control. So this is priority number one in tobacco control for this year. Another perennial bill that we're seeing is the pharmacist prescribing tobacco cessation, super important to our constituency of TCRC, that the more access we can give to consumers, to smokers, to tobacco users, to nicotine replacement therapy, specifically here in this bill, the more likely we're going to see successful quit rates. And so this bill is a modified version of previous versions, though this version did pass through the Senate previously in 2020. It was not considered in 2021. Again, the pandemic skewed everything. This would only covers the pharmacist prescribing nicotine replacement therapy. Previous versions also allowed them to prescribe other non-OTC medications like Wellbutrin, and there was some pushback against that. Why do you need to prescribe OTC medication? Well, for Medicaid recipients and many, and pretty much everyone with health insurance coverage, your health insurer will actually then have you just pay the copay, or no copay in many instances if you have a prescription. And so the benefit to the consumer is they can have ready access to a cheap method, but an effective FDA-approved method for cessation. So this bill is super important, supported by lots of folks in the cessation community. We did have the House bill hearing was on January 20th, and as you can see, next Tuesday, the Senate bill will be heard before the Education, Health, and Environmental Affairs Committee. If anyone is interested in testifying next week, you actually have to sign up Friday. So let us know if you haven't signed up and you want to sign up, and we can facilitate that for you. So an important bill. And I just wanted to highlight that what we might see this year, or what we might see coming up in the future, are bills related to the regulation of synthetic nicotine. So many of the products, vape products in particular on the market, non-cigarette tobacco products on the market, are now alleging, at least, that they are made with synthetic nicotine. So they are actually exploiting a loophole in federal law because the FDA, Center for Tobacco Products, does not have regulatory power at this time over products that contain exclusively synthetic nicotine, because they can only regulate products that are derived from tobacco products. There's some question under Maryland law whether we actually, I believe many of our laws already cover synthetic nicotine with respect to sellers having to be licensed, not selling to kids, and to be taxed, because in many provisions in our code, it defines the product as containing tobacco or nicotine, and not and nicotine, or derived from tobacco nicotine. And so there's a good argument for why we might not need a synthetic nicotine regulation in Maryland, but there still could be a bill that comes in related to that to make that clear. The other issue is in this space that a lot of these products actually, we don't know if they actually contain synthetic nicotine or if they're just saying that in order to avoid federal regulatory oversight. So this is a, kind of an emerging area that I thought was worth mentioning on the slides here. So as promised, I was quick and I can, I think there's a, I don't know if there's questions in the queue because I can't see that, but I'm happy to answer any questions that have come up.
Are there any questions for Kathleen? Put them in the chat.
I see a hand up and I'm not sure how you guys are handling that. Doreen Fassett has a hand up.
Yeah, Doreen, you can unmute and ask your question if that's a question. Sometimes people just hit the hand without having a question, really.
I actually hit the hand without asking a question, but it's always good hearing her and getting information. I'm taking screenshots and everything, so it's gonna be some information to share with our drug-free coalition. I think he's on here as well.
Awesome, and the slides are available to you guys afterwards, so absolutely.
Awesome. Thank you.
Mm-hmm.
Great. Any other questions? Well, as usual, Kathy, your other Kathy said thank you, and you're always informative, and so that's wonderful. I'm glad you can be here, and good luck on your testimonies in front of the legislature there. So
thank you guys so much for having me.
Okay, look forward to your conference. Remember, there's a legal resource conference in May. You're muted. You got to unmute.
Oops, sorry, yes. I misspoke earlier and said May because it's always been in May, but it's in June this year. And I'm sure Brooke or Blair can put that actual date in the chat box. I'm embarrassed that I don't know it off the top of my head.
No problem. Okay, thanks. Okay, and you can, Dana, you can put your slides up as I introduce you. So the next person who is going to kind of give us some updates and is here for the first time as the director of the Center for Tobacco Prevention and Control is Dana Moncrief. Dana's been around for a while and has been helping us and collaborating with us for a number of years. But as many of you know, since last year, Dawn Berkowitz has left the Tobacco Prevention and Control Center and has moved to a different position. And Dana has become director. And so welcome. She brings a lot of different experiences. And actually, Dana, in the midst of all of this, was doing two jobs. She was the acting director for a while, plus doing a lot of stuff with COVID testing and vaccine delivery and whatever. So I'm hoping that she benefited from this morning's mindfulness kind of talk, and you're back to kind of having one job, hopefully, but we'll see.
Well, I'm actually still doing two jobs. So
I see.
The COVID response, it has certainly been eye-opening and learned a lot and learned quickly. But thank you for the kind introduction and welcome everyone. This has been a great conference so far. I love the morning and definitely Judson's presentation. So that was great to see, and just thank you so much. And again, I hope we'll be able in person next year. So I thought I'd just start today. There we go. I thought I'd just start today with some reflections. So yesterday I spent some time learning how to make a word cloud. So I'm very proud of myself for this, but just thinking over the past 2 years, you know, all the words and new terminology, terms that I never thought I'd be using in my regular vocabulary, and feelings, and just reflecting over the past year. And certainly, you know, words such as stressful or scared, worried, tired, frustrated, all come to mind. But also then reflecting a little bit more, thinking I'm grateful. You know, there's thinking of self-care. And really, I wanted to say thank you. Thank you to all the public health heroes, the healthcare heroes. There's just a big sense of community, and it's just wonderful to see. Amazed is another word that comes to mind. Just everything that we're still accomplishing despite all the challenges that we've encountered. And I realized after I made this, there's probably 10 other words I would have added. So I actually invite all of you to put in the chat if there's any words that you reflect on over the past couple of years, or from this morning, or anything that you might want to reflect as we're going through the presentation. And maybe I can make another word cloud if we are able to save it. And so certainly we are focused, there is a big focus on COVID-19, but we know that tobacco product use, particularly smoking, does have a link with COVID-19. So both the World Health Organization and the CDC have stated that being a current or former smoker may increase your risk for severe complications from COVID-19 disease. Of course, we know that COVID-19 attacks the lungs. A smoker's lungs might already be damaged already. So that really could complicate if the COVID-19 also impacts them. But we do know in tobacco control, we have our own vaccine. So this is from the CDC. We know it works. Price increases, cessation access, hard-hitting media campaigns, and smoke-free policies. And we even have a booster, so point of sale initiatives. So we do have our own vaccine. We know it works. And you know, we're doing this at the state and local level, certainly. So to provide some national updates, as usual, every year, either the day before or the day of, the American Lung Association releases their state of tobacco control. So here's the 22 report. So we did actually increase from an F to a C for tobacco taxes. And you know, Kathy and others have mentioned last year, taxes increased for tobacco products. So we are up to a C. And we still have our A with smoke-free air, a very comprehensive law, and a B, an access to cessation services. We have a robust Quitline, many local programs, and strong health benefits for state employees. And the American Lung Association calls for 3 actions. So to, again, address the needs in the clean under air and close any loopholes, defend and preserve the much needed funding increase. So this will come from the tobacco taxes. The program is expected to get an additional $8.25 million if the budget stays intact, and certainly overturning preemption and all things that, you know, I think at the local and advocate levels, we're working on in the state. As Kathy just mentioned, she's heading to the hearing for preemption. Campaign for Tobacco-Free Kids released the broken promises to our children. This again is showing how much the tobacco industry is spending on its products. And so they're spending $11 for states only spending $1 on tobacco prevention programs. So huge disparity. We are actually, so on the side here, this is kind of in line with our vaccine, the recommended strategies, and certainly what the Lung Association recommends as well. The numbers here, death caused by smoking each year, 7,500 people. Proportion of cancer deaths attributable to smoking is 27.3. Annual healthcare costs directly associated with smoking, 2.71 billion. And the estimated annual tobacco industry marketing, 116.2 million. So these numbers really haven't changed over the years. And you can see the chart here on the side. We are ranked, so our state funding is about 22.6% of the recommended CDC spending, which is 48 million. And we are ranked number 20th in the state for our state funding. So now looking at national data on adult and youth use of tobacco products. So this is from 2019. We likely presented this again last year, but 50.6 million adults, or 21%, currently used any tobacco product in 2019. Cigarettes were still the most common product used by adults, and 5% of adults reported current e-cigarette use, with the highest population within the adult population of 18 to 24-year-olds using these products. And what's always striking is that over half of these young adults reported that they had never smoked cigarettes, so they went straight to vaping. And the prevalence of current tobacco product use was higher. among certain populations, those that had a GED education, had an income of less than $35,000 a year, were uninsured, had Medicaid or other public insurance, had a disability, or had mild, moderate, or severe anxiety. The Monitoring the Future from 2020 so found that among college students and young adults, vaping nicotine increased significantly among young adults, and they used the age range of 19 to 30. And this is between 2017 and 2019. So it more than doubled from 6.2 to 14%. And in 2020, vaping nicotine was steady at 13.7. So a slight reduction, but it still remains steady. Cigarette use has declined to all-time lows among young adults in 2020. So it declined from 2015 to 2020, 16.5% to 9.5%. And the perceived risk of regular nicotine vaping increased significantly between 2019 and 2020. So over 35% of young adults believe people risk harming themselves with regular nicotine vaping. And that's up from over 27% in 2019. And this was from the National Youth Tobacco Survey, again from 2020. And so they did find that tobacco use did decline slightly. However, still stressing that 3.65 million high school students still use tobacco products in the United States. And of that, ESDs, e-cigarettes, are still the most used tobacco product among youth. And you can see there on the chart, it's at 19.6%. Looking at our statewide data, this is a preview of the 2020 Burfus data for the adult tobacco use, pulling out some adult tobacco use figures here. So there were no products that had seen significant increases between 2012, when we first started the new methodology for Burfus, through 2020. So that's great. We've actually seen a decrease in cigarette use. So it was 16.2% in 2012. We're now at 10.9%. So we're moving towards that 2030 goal. We are closer, the healthy people goal. And cigar use is 3.3%, down from 4.4 in 2012. There weren't any significant changes in smokeless tobacco use or ESD use. So looking at youth tobacco use, we unfortunately were not able to get into the schools in 2020 because of the pandemic. We typically do our youth risk behavior survey, youth tobacco survey every even calendar year. So what we wanted to do though is put together a small survey, and so we came up with the 2021 Youth Pandemic Behavior Survey. And so this survey, it was last year from May to June. It was a very quick turnaround. It was online. We worked with a contractor. And just we really wanted to know how students are coping during the COVID-19 pandemic. This is a much smaller survey than the Youth Risk Behavior Survey, which we've surveyed almost 70,000 students. So this, we were able to get 608 responses from public and private Maryland high school students ages 14 to 19. We did base the questions from our YRBS YTS survey, some additional YRBS questions. And then there was also the CDC Adolescent Behavior and Experiences Survey that we also took some questions. So there were 70 questions total. 14 were actually COVID specific questions. And so the students were recruited and they did get a gift card incentive to participate. So some initial findings from the YPBS, always hard to remember the letters. So 27% of the respondents used more tobacco during the pandemic. So you see we have a breakdown here on the right. Still with ESDs, those were the highest used product at 11%. Smokeless was at 5%, cigars 6%, and cigarettes 7%. You can see on the left, we also asked about brand preference. So Puff Bar is up there at the top, followed by Views, Juul, Blue, and Sworn. And ESD flavor preferences, fruit, 34%, candy and sweets, 21%, and then it drops to 12% for menthol, 11 for mint, and 10 for alcoholic drink flavors. And so we did put together an infographic, and we have a report with all of these findings. It's not just tobacco, it's across the board, all of risk behaviors. So we will be able to post that shortly on our website, and we can share that. Just going under some final review. And we are putting together a couple other infographics that we can share as well. But you can see here, that significantly, the COVID-19 pandemic has significantly affected high school students, including struggles with mental health, tobacco use, alcohol, drug use, trouble with schoolwork. And then you'll see on the second page on the right, we are really focusing on ACEs and behavioral health. So you can see 23% experienced a parent or adult at home hit, beat, kick, or physically hurt them during the pandemic, or 17% went hungry because there was not enough food in their home during the pandemic. So these are really important measures in how we can help, even with tobacco control, to address these ACEs and help kids and get them the support that they need. So moving back to the Maryland Risk Behavior Survey, Youth Tobacco Survey, many of you know this is a mandated survey. Because we weren't able to get into the schools in 2020, we were able to move forward in the 2021-2022 school year. So we started September 27th, and we're just finishing up this week. We had to push them back to this month because of school closures, but you know, it has been very difficult this time and challenging, but we were able to get in and have the surveys administered. We used with both middle school and high school. So new this year for middle school, we asked about disability status, mental health, adverse childhood experiences, and COVID. For high school, again, the same as middle school, but also adding gambling and marijuana use. We were in 368 schools, and you can see the breakdown, 183 middle schools and 185 high schools. So this data will be sent to the CDC for processing, and we expect to have the data, we hope, by the end of this year. So I wanted to move on to local health department updates. So of course, COVID-19 has impacted local health departments, local public health tobacco control programs. We understand, we know that many of you have been reassigned to work on the COVID response. So you can see local health departments work on school-based, community, tobacco enforcement, cessation. And unfortunately, there have been many decreases between FY20 and FY21. We are moving forward in FY22 with agreements and increasing partnerships. There certainly have been drastic decreases, and understandable, of course, with everything that's happening. But I did want to point out, though, that despite all this, our local health departments and programs are so resilient, even with the decreases in some of the activities. You know, there still was a lot going on. So we have in some counties a pregnancy and tobacco cessation help program. Those 5 counties educated over 380 pregnant women on the dangers of using tobacco and nicotine during pregnancy. School-based and community-based efforts, we know in Dorchester, I think, and Talbot, they provided a virtual vaping PowerPoint presentation to give to parents and teachers. In Cecil, they worked with youth empowerment, Source drug-free councils to have a video contest for students answering the question, why I live drug-free. Many others are partnering with other jurisdictions, Baltimore County, work with Frederick on a vaping campaign, and several other community-based partnerships and working with FQHCs and others. So there still was a lot of work happening, and I just congratulate all of you at the local level for doing, and thank you for all that you're doing. And certainly with cessation and tobacco use treatment, having to adapt. We can't do all the in-person counseling anymore. So adapting to virtual or more phone counseling, and again, working with FQHCs and partners to distribute NRT. So moving to tobacco retailer enforcement. So again, due to COVID-19, we have not been able to perform retail inspections in 2021. So we did not do signer or FDA checks. We are getting back up and running. So our most recent retailer violation rate for SINAR was 13.1%. We hope to be out in the field here by March. And just again, kind of, we're experiencing the same issues I'm sure everyone is with staffing or reassignments to COVID activities. So we're doing what we can. And local health departments are resuming some compliance checks in most jurisdictions, and jurisdictions are still maintaining a strong presence in doing educational campaigns. And just some highlights from FY21, local health departments conducted over 2,800 compliance checks, with 180 of those checks after local citations to underage persons. Law enforcement agencies issued 463 citations for illegal sales of tobacco products, and they referred 126 retailers to the comptroller and the Alcohol and Tobacco Commission for multiple repeat violations. So there's still a lot of work being done. So I wanted to provide an update. So this morning was a great presentation and very timely, looking at what Amanda Fallon Bennett provided with the LGBT populations. So we are working with our CDC grant. One of our populations of focus are the LGBTQ populations and communities. We are very close to contracting with a local lead agency, which was part of the CDC grant requirements. So they have been identified. We're just finishing up the procurement. So we hope it'll start in February, and we'll certainly keep everyone posted. But they will lead programming and evaluation efforts and outreach to targeted communities with LGBTQ populations. We are really focusing on behavioral health. We have for the past few years, but we're certainly expanding this. So we have disseminated a survey to behavioral health providers in Maryland to identify facilities, what type of smoke or tobacco-free policies do they have? What type of tobacco cessation treatment do they provide? And so we're going to use the survey as a baseline, just especially to look at the policy landscape. Here's a survey link. It'll be open until mid-February. So certainly if you are a behavioral health provider, if you know of anyone, please share the survey link. We want to get as many responses as possible. But it should be a very interesting, we want to make sure we're providing recovery friendly environments, recovering from all mental health and substance use. So then youth e-cigarette prevention. We are looking at youth engagement, developing and posting resource reminders, identifying ways to work even on college and university-based initiatives. We did a program with the Cure Scholars Program through the University of Maryland, Baltimore over the summer, developing a curriculum and engagement activities for middle school youth in Baltimore City. So a lot of different avenues, and not just working directly with youth, but also parents, teachers, and other influencers too. And certainly we're looking at several additional efforts. We really expanded our partnership with BHA. We've presented on many of their council meetings. So we're really building those partnerships and collaborations. There's several internal ACEs work groups. We're measuring ACEs with YRBS, YTS, health equity, school health councils, the list goes on. So we are doing a lot of outreach and building up our partnerships to address health equity in Maryland. I'll go through this quickly. So with our media campaigns, we have our contractor, Red House Communications. We've had Quitline, behavioral health focus ads, Tobacco 21, and the Vape Experiment. So here are some examples of our ads. The top left is Continue the Good, which is a campaign for providers. And Make This the Quit That Sticks. We air that over New Year's. In the middle, that's Joanne. So she on Facebook, and she's actually a real Marylander going through her quit process. And then in the upper left, we have pharmacy bags too. We love these, that's the prescription bags, and we're continuing to do that as well. They really stand out. If you have any need assistance or want to request any files, please reach out to Ariel Juberg on my staff, and she can certainly help you. And then we have This Is Quitting, Maryland is Ready. So this is for youth prevention. So it's the vapeexperiment.com is our campaign. But we also partnered with Truth with This Is Quitting. Youth can text READY to 88709 and they'll have a vape or a text-based service to help with quitting vaping. And from January to June 2021, over 100 people in Maryland subscribed to This Is Quitting. And these are our posters at the bottom, which we're happy to share, and they're all downloadable at thevapeexperiment.com. And we have some websites that I'll reference. Again, you'll get these slides. So we have Continue the Good, which is for providers, behavioral health providers, and key resources on e-cigarettes and vaping. A lot of good resources there. With the Quitline, I'm sure many of you know, it's free, 1-800-QUIT-NOW. It's on Smoking Stops Here. 4 ways to connect, 1-800-QUIT-NOW, or you can go online and click the Enroll Now button at Smoking Stops Here. You can text READY to 200-400 to enroll into services, or you can get a provider referral as well. Free NRT is directly mailed to participants who are 18 and older and are able to use the products. And callers are 5 to 8 times more likely to quit tobacco by using the Quitline than trying to quit on their own. And 97% of Quitline callers would recommend the program to other tobacco users. Our Quitline has many specialized programs, including the behavioral health protocol. It's an enhanced system for those identifying with behavioral health conditions. 7 calls, you can see the list here. In our evaluation, they found that they're 50% more likely to be quit at 7-month follow-up compared to the standard programs, and 95% were satisfied with the program. You can see we're also collecting the demographic data. So 251 callers identified as gay, lesbian, or bisexual. Majority reported as having Medicaid or Medicare insurance. Over 10,000 reported mental health conditions, and 25% reported having a disability. We did see decreases in COVID or Quitline utilization during COVID. So 6,063 phone and 1,072 web participants in FY21. So that was a 22% reduction in Quitline registrants and a 3.2% reduction from FY20 to FY21. Despite that decrease though, 42% of callers said their motivation to quit increased because of COVID-19. We're continuing our health system initiatives. We've issued several grants. You can see our great partners there on the right. So they are implementing tobacco user screening systems, integrating into EMRs, providing trainings, dedicated tobacco dependence treatment coordinators on site. So really a lot of great work happening in the health systems to really integrate tobacco prevention and cessation into routine clinical care. There are 2 studies that the Quitline has been a part of. I'll skip over this because I know I'm running out of time. I'm probably out of time, but there's the Educating Quitline Users About Lung Cancer Screening, or the EQUAL project. This is with Georgetown Medical Center. So the Georgetown Medical Center, let me find my notes here. So they're really looking, it's funded by the ALA to assess the impact of educational interventions on eligible Quitline callers to obtain lung cancer screening, which is proven to reduce lung cancer mortality to date. So far, we've had 243 participants, average age of 61 years old. And there's different demographics, but 91% said they would probably get a CT lung cancer screening if their doctor recommended it. And we're also doing a breath monitor study. This is with our Quitline provider, Optum, and their contractor, Vincere. So the study questions, does adding carbon monoxide monitoring to Quitline services improve engagement and satisfaction in quit outcomes? Does adding incentives to carbon monoxide monitoring improve Quitline engagement? And does the approach improve engagement or outcomes for priority populations? So you can see it's randomized into 3 groups. It launched December 31st and will go through the spring. And we should have our results by the end of this year that we can share with everybody. And if you'd like more information about this, you can certainly reach out to Sarah Wolf, and she can provide you with that information. And then just to wrap up, looking forward, our new normal. I'd be remiss if I didn't mention and put on my COVID hat and mention some of those state resources. You know, can we get COVID to an endemic? We all know the public health tools that are available. But just so everyone knows too, at the state of Maryland, we have a vaccine locator, test site locator, treatment options like monoclonal antibody infusions. And we even have a Maryland COVID at-home test reporting portal. So if you do have a positive test from your testing kit at home, you can actually submit it and get an excuse letter if needed in order to stay home from work or school. In tobacco control in FY 2023 and beyond, we are expected to receive a funding increase of 8.25 million. So we are looking at that, you know, again, if the budget stays intact, certainly looking at how we can distribute that locally and statewide programs. We will be returning to schools in the fall of 2022. So it'll be 2 YRBS YTS surveys in a row, which actually should be pretty interesting. And we are going to send out a survey, stakeholder survey, to determine how the YRBS YTS is actually being used and can we modify our questions. And we'll continue to work on Quitline enhancements, certainly enhancing local community-based health disparities programs. We'll be conducting needs assessments and working more with schools and universities. And then my last slide, this, you know, kind of all works together from this morning's presentation. Certainly take care of you. Again, thank you from the bottom of my heart for all of the you all are doing in the field, whether you're directly responding to COVID or continuing programs under stressful situations. Please make sure you're taking care of yourself. I've put together some of Maryland's resources to help you, but certainly there are many more out there, and really encourage you, please take care of yourself. Self-care is so important. And again, thank you for everything. And here's my contact information. Please feel free to reach out to me. If I can't answer the question, I'll direct you to my staff who can, but I did also want to thank all of my staff as well. It's been a year of changes, a year of challenges, and they've just really risen to the occasion and, you know, love the support that we have in our Center for Tobacco Prevention and Control. And that's everything I had today. I don't know if we'll have time for questions. I think I went over.
Yeah, Dana, we don't have time for questions. We might be able to, I mean, if you want to look at the chat maybe and respond via there, or we can do it for you. But we do need to kind of keep on schedule. So Carlo, I don't know if you are ready to jump on.
Sure, I'm here as soon as I unmute. Thank you, Dana. That was great. And you're doing really a lot of wonderful things. So great to be partners with you. We have just one more thing to do before we kind of, I guess, take another break and then kind of come back for our afternoon keynote. We typically give out kind of Quitline referral awards to try and kind of incentivize people and to reward people for doing some of the things that we do. So Ashley, are you putting up the slides? Or
Sam is here.
Reshma?
Sam is
Yeah, I apologize. Zoom is not letting me pull up the slides right now. I don't know why. And I apologize for that inconvenience.
Okay. So let me just say what was on the slides. We are trying to recognize kind of the people who have done yeoman work in getting referrals out. And so we want to kind of spotlight representatives from the agencies who are here. Calvert County, I think you see we have Jane and Tammy are joining us today. Jane Dodds is the, oh, there we are. Well, that's honorable mention right there. Yeah, Jane Dodds is the County's tobacco coordinator, and Tammy Halterman is her supervisor. And so both of them are there. We've been trying to pin them. I don't know if we can kind of highlight them, but we want to congratulate them. That's a fax referral award for the using the fax system for referral. When we talk about online referrals, so people can also refer using email, Caroline County, we want to highlight them. Lee Marquez is also with us today, and we want to kind of thank her for her work. She was identified by Optum as the primary person making the Quitline referrals in their county. So congratulations to you and to the health department there. For the EHR referrals, we're recognizing the East Baltimore Medical Center and the Baltimore Medical Systems. Dr. Catherine Shaw could not be with us today. She was referred to us by Dr. Daniel Ford at Hopkins as the best representative to accept this award on behalf of the EBMC. The confidential nature of the EHR referrals precludes us from identifying individual providers who make the referral. So this is more of an organizational group. So we want to thank all of those folks, Jane, Tammy, Lee, Catherine, and all of the people who work with you to kind of make this successful and to link more of our smokers here in Maryland to the Quitline. We also want to recognize, and that's the next slide, that there are some folks who have continued to do great work. We don't want to just give them the reward or the award every year, but the Shepherd Pratt Health System is doing terrific work and continues to do that. University of Maryland Charles Regional Medical Center has also done yeoman work, and the Hopkins Outpatient Medical Clinic. So we want to thank all of the people who have been part of this in doing all of the things that are needed to kind of link our smokers to resources. And the Quitline is a critical resource for the state. It has been and continues to be one that actually helps a lot of our smokers to quit and supports them along the way. And again, I'll mention that a number of folks you saw in Dana's presentation, a number of folks who identify as having kind of depression, mental health kinds, anxiety, mental health kinds of issues do call. I do that. Also, I wanted to kind of, Lee has just texted that she wants to make sure that we notice that Heather Grove, a nurse, was instrumental in starting our Quitline referral partner program. So we want to recognize her as well.